to call us at 800-859-0957. Dr. Nemeth, Dr. Katranji, welcome back. It is a thrill to have both of you here. What you're doing is not only state-of-the-art, but very rare. Because as a periodontist, as a dentist, you're looking at what exists in our mouth, in our oral cavity that leads to disastrous diseases. So Dr. Nemeth, I'm going to start with you. I've been many times watching patients go through this process where you swab the mouth and then all of a sudden it's up on this 90-inch screen with a million bacteria floating around. What does it tell you and how does it help the patient?
By the way, I want to thank you for this opportunity to get the word out, because people just don't understand how dangerous and devastating gum disease is. I mean, it can actually take 5, 6, 7 years off of normal lifespan if you have these bacteria and parasites in your mouth, because they travel throughout your body. They cause devastating effects, including all indications Alzheimer's disease. That's more recent. We know it increases heart disease risk. If you're pregnant, you likely have a underweight child, preterm birth. Anyway, it's devastating. So I've had patients say, well, Dr. Nemeth, I mean, I've had this disease. Is it too late? Because these organisms, these parasites and these bacteria, they've been, you know, I've had this for years. Is it too late? I mean, they've already done their damage. Well, the answer is it's not too late. It's never too late. Why is it not too late? Because, yes, these bacteria, as long as they're in your mouth, they also get into your bloodstream. They travel throughout your entire body. Wherever your blood goes, these parasites go, these bacteria go. And as long as you've got it, they continue to feed into your bloodstream. But your body has defenses. Your body isn't defenseless. But your body can't do much if it's continually being fed these toxic substances, these bacteria and these parasites. But if you can stop this infection, then the body has a chance to fight off the organisms that are there and at least get a, let's call it a fresh start. So it's never too late. The sooner you get started, the better, of course, but it's never too late, because your body's defenses can't destroy these organisms, can fight them off if it has a chance to do that, but it won't have a chance to do it unless you stop the infection from draining into your bloodstream.
Well, I think what you both are doing is amazing, and I think, you know, all the members of my family have been to see you already, and I'm encouraging them all to go, because what I've seen and what I've watched and seeing this test being done and looking at the pathology, the bacteria that's in your mouth. We know there's normal flora there, but you also have pathogenic bacteria floating around that cause all these disastrous diseases. And with the incidence of heart disease and especially Alzheimer's, everybody's afraid of that because that's a death sentence. I mean, as far as I know, you're one of a population of almost none, that you're almost a medical dental periodontist, because what you're doing, although you're treating the gum disease and killing the gum disease, but you're stopping an amazing array of lethal final diseases that kill people. And this is what I want to, you know, say about getting the word out, because it's very important to me as the patient advocate. The patients know that they need to be, you know, be aware of this test that you do, because, you know, if nothing else, whether they have gum disease or whether they don't have gum disease, just getting that done and taking a look at the pathogens that are in the mouth, knowing that you can cure it. What do you do when you discover those deadly pathogens in the mouth? What's the next step?
Well, we can treat that. There are a number of ways to treat it. One of the ways is to surgically remove the diseased tissue, but with traditional surgery, and that's used in some cases. Mostly I try to do a minimally invasive procedure, which is using a laser, and the laser will destroy these organisms. It will destroy these parasites, and when the parasites are gone, the bacteria that accompany them are destroyed as well. So we just see there's two parts of treatment. I've mentioned this before, and I tell this to every patient. I can usually stop the infection. If there's enough bone, I can save those teeth. But if the patients don't know what to do and do it, it's going to come back again. We do half the treatment and the patient does the other half, but we don't let that patient go. That patient is our prisoner until we know they're
But that's
taking good care of their mouth. We're very, very adamant about that. And then we check them periodically, perhaps a few times a year, to make sure they know what they're doing it properly, so that gum disease doesn't come back. So we can stop it, but unless you know how to take care of your mouth properly, it will come back. And if it keeps coming back and keeps coming back, you're gonna lose your teeth. And if you lose your teeth, then really you're gonna have dental implants, which is what my partner, Dr. Katranji, is like the greatest at. In fact, he just recently completed a very interesting seminar involving something called zygoma implants for people who don't have any bone. And
well, let's come back and talk about that
that's
on the other
important.
side of the break. In the meantime, you're listening to the Dr. Nemeth and Dr. Katranji radio show. Both doctors are here tonight talking about the seriousness of undetected gum disease and how the treatment of gum disease can prevent many catastrophic diseases. If you have a question, you can call us at 800-859-0957. Don't miss this opportunity to talk to the doctors directly. You're listening to the Dr. Nemeth and Dr. Katranji radio show on 760 WJR.
All right, you guys, we are live on YouTube. This is a little bit of a different
John, hi.
method.
I got you.
We're just not seeing you.
Mhm.
We have to.
We've got Dr. Katranji over here.
We've got Skylar here.
So
So
it's
if we get any questions, write them down or something.
Yeah, I'm watching them. I'm here.
We'll welcome, we'd love to have some questions from all of our viewers.
Oh, yeah, that's
And then
right.
you'll say, okay,
Uh,
sure.
Okay, yeah.
They will be
That's
interesting
good,
topics
just
to
hit me.
discuss, whatever the questions are.
Yes.
Yes. Someone was saying that they're coming all the way from Austin, Texas to come see you, and they just booked their
You'll have to
appointment.
talk louder because I have these things on.
Someone just booked an appointment from Austin, Texas. They're coming to the office in September, so yeah, you'll have.
We don't accept patients from Austin.
He's calling tomorrow to schedule.
What?
He's calling tomorrow to schedule.
Oh, okay.
And Monica says, you saved her life. Thank you so much.
Who said that?
Monica, Liok.
Okay.
She said you saved her life.
Nice.
Well,
So, Dr. Nemeth, just so you know, that's the clock up there. So when I get down to 30 seconds, we're off.
Give you guys a little,
what are you down to now?
give you guys a little perspective of where we're at here.
When does it start?
We're back on in 2 minutes.
Also, we've got 2 minutes.
At
But
19, yeah.
meanwhile, we're on
So
live
this is
stream,
when we're
right?
back.
We are.
Mm-hmm.
Give you guys a little idea. We are in Birmingham, Michigan, filming this right now.
Oh, whatever.
So, but I mean, just because what you're saying is important, but I just want to make sure that you get finished with what you have to say.
I'm never gonna get finished.
Oh, that's okay, that goes without saying, whatever, okay. Anyway,
Anybody who has any questions, feel free to ask at any time. We are here. Got Dr. Nemeth, the man, the myth, the legend himself right over there, and Dr. Katranji, and Anne Marie, who has been hosting the show since we've been doing it for the last 2+ years. And yeah, we're in a different room than we normally are, but it's a good setting. And yeah, we're happy to have everyone here.
30 seconds and we're back, so I'm gonna switch over to Dr. Katranji, if that's all right with you, Dr. Nemeth. I'm gonna let him finish, I'd like to cut him off.
He's half of this whole deal.
No, I'm going to let him finish.
I'm the lesser half.
10 seconds and quit arguing. Oh my God. We should just do outtakes of this show, we'll make more money.
I know, this is kind of like the live outtake version of the show.
Welcome back to the Dr. Joseph Nemeth and Dr. Mark Katranji radio show. I'm your host, Anne Marie Cronin, and we are here tonight talking with both doctors, both board-certified periodontists in Southfield, Michigan. They're here with us discussing the latest treatments in periodontic care and the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctors, please call us at 800-859-0957. Dr. Nemeth, coming back to you, I didn't mean to cut you short, but you were explaining the process.
Well, what I was talking about is for those patients who unfortunately have already lost their teeth, or where they can't be saved. And some of the, Dr. Katranji can virtually always put implants in, and now we have an even new method of putting implants in. I had a patient who came in the other day and she says, well, they can't do any implants. I went to the doctor and he said, I don't have enough bone to do implants. Well, that patient may not have enough bone, and usually this in the upper jaw, to do implants normally. But there's a technique where Dr. Katranji goes back to what's called the zygoma, which is the bone that is underneath the orbit, the oral orbit, and he can use that as a source of bone to put implants in.
That's right.
And so, I mean, I cannot imagine a case where Dr. Katranji would not be able to place implants to rehabilitate these patients, and it's really good.
Yeah, so a lot of times we have these patients that come in, maybe they've been in dentures for decades. So sometimes they come in and they've seen other people, and in order for them to get implants, they need bone grafts, they need, years of treatment before they can actually have teeth again. And some people just don't want to go through that, or it's sometimes unpredictable. It can be quite unpredictable for somebody to be, with very little bone for so long. And so there are options for these patients. And as Dr. Nemeth was mentioning, sometimes we have to go to another site. We have bone in our jaw, and then we have bone outside our jaw. And that bone sometimes can anchor an implant immediately so that we can then place the teeth immediately. So in one day, people are going right back into teeth that are fixed. No longer do they have to go to an ill-fitting denture or something that's just not giving them the quality of life that they might be looking for. So these are things that we can do now in the office. And it's immediate for many patients, and in some cases, this is life-changing.
It is life-changing. I have 2 implants that Dr. Katranji placed in my mouth, not because of gum disease, God forbid, because otherwise I shouldn't even be here. But
Okay.
I had some root canals that failed, and at any rate, there were 2 teeth that needed to be removed. Dr. Katranji put implants to remove them, put implants in the same day, and then once they took, permanent teeth were put on them. I can't even tell you which teeth they are because they're so much like my own natural teeth that they're
You don't
great.
notice the difference. Mhm.
Yeah, I don't notice the difference. And the great part is you never have to worry about getting decay. These teeth never get decay. They
Good
never
point.
need a root
That's a good
canal.
point.
Implants are totally great.
Well, let me just ask Dr. Katranji while we're talking about this subject, 2 things that you said that sort of struck me that the average audience might not know, and I didn't know, that if someone already has dentures, they still have hope that they can get implants. I didn't know that.
Yeah, so what happens when you wear a denture is the bone that's supporting the denture actually starts to dissolve.
Mhm.
You lose the bone. And in many cases, if you go to somebody who might not be comfortable with these advanced techniques, they might look at you and say, you know what, it's not worth it, there's too much work involved. The truth of the matter is for 90%, if not more, we have a solution. We can place implants the same day, and we can place new teeth the same day. So implants and teeth, they go home with the same day in a matter of hours. And they can function, they can smile, they can chew. These are things that can happen in a relatively short period of time. So we just need to see, evaluate, we do a CT scan, it's a nice 3D image, and usually within a few hours we're able to determine and get you set up for a procedure to really give you a new smile, a new set of teeth.
And even if it takes a while for the bone to attach to the implant, that doesn't mean you can't have a temporary tooth put on that implant so there's something there, and then as the bone attaches to the implant, you can have the permanent tooth put on where it can absorb a lot of pressure.
That's right.
So I mean, implants are really the way to go, because if you have a bridge instead of implants, you have to grind these teeth down.
Yeah,
File them down in order to support the bridge. And when you file the teeth down, you run the risk of killing the nerve or the nerve dying. You run the risk of decay getting under those teeth that had to be filed down and are supporting the bridge. It's just implants, in my opinion, when possible, are really are great. We have a couple of calls and some questions. So this particularly grabbed me because Pleasant Building.
That's his name.
Well, I guess this is a building that asked for question. Is that Pleasant Building or Pleasant Bulldog?
A Pleasant Bulldog.
Okay. Anyway, we have a question from a bulldog. We don't normally treat animals at the office, but we're considering it. And the question is, can you perform the pinhole on people with thinner gum tissue? This is really, really interesting. I had a patient in yesterday, as a matter of fact. She came in, she said, you know, I was told that I went to someone who did the pinhole technique. She went to at least one person, and they said, oh, no, you can't do the pinhole, your gum tissue is too thin. Well, that's what the pinhole is all about. The pinhole is all about making that gum tissue thicker, getting it thicker and healthier. So it's particularly important for people who have thin gum tissue. It's definitely an excellent procedure, and thin gum tissue is not only not a barrier, it's an indication, because when you have thin gum tissue, that is the type of tissue that recedes very easily. And with the pinhole technique, we can prevent that recession, or certainly minimize it, because that gum recedes, the bone recedes, and you become more at risk for losing the teeth, as well as sensitivity and cosmetic problems.
Mm-hmm.
So yes, definitely that's appropriate.
Got more questions?
So, Mr. Bulldog or Mrs. Bulldog, I hope you are happy with that answer. I'm gonna answer.
You have another question?
There was one other question, and it says, hi doc, do you recommend brushing without toothpaste if brushing with an electric toothbrush, Oral-B? Well, as I tell patients, I do not use toothpaste. I don't use toothpaste. I don't use chemicals in my mouth. I try to avoid it because, as studies have shown, I'll say this one more time, all toothpaste, virtually all toothpastes have abrasive agents in them. And those abrasive agents can actually cut into the teeth, cause notching, possibly contribute to recession and sensitivity. Those same studies show that if you brush without toothpaste, you will not get that notching, almost no matter how hard you brush. Otherwise, it's like sandpaper, you know, rubbing the teeth with sandpaper, depending on how much abrasive is in the toothpaste, but they all have abrasive. Now, some people may need toothpaste for special reasons. Sensitivity, possibly, or some sort of bacterial problem, but basically, I don't use toothpaste. And this is an addendum very quickly. I've had several patients come in with lesions in their mouth. Their gums are sore, they're red, they don't know what to do about it. I said, stop using all toothpaste, stop using all mouthwash, use no chemicals in your mouth. Most of these people come back 2 weeks later and their mouths, the soreness is gone, they're much more comfortable, and something in the toothpaste has created this response. So
Well, let's come back,
That's
Dr.
it.
Nemeth, and talk about this on the other side of the break. In the meantime, you're listening to Dr. Joseph Nemeth and Dr. Amar Katranji, and we're talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question and you want to call the doctors directly, please call us at 800-859-0957. Again, don't miss this opportunity to talk to the doctors directly. You're listening to the Dr. Nemeth and Dr. Katranji radio show on 760 WJR.
All right, you guys, let's keep the convo going a little bit. We've got close to 60 people here on YouTube.
The ads came in, I know. But
Yeah.
That's why we have to watch the clock so that when it gets to 30 seconds, we're done.
Oh yeah, and we
Once-
can
Don't you hear the music when you hear the music playing, Dr. Nemeth? Do you hear the music?
we can chime back in at any time.
Wow, okay, do you, Dr. Katranji, do you hear it when the music comes on?
I get too excited about
Yes.
what I'm doing. I don't pay attention.
We
He's blocking, yeah, I know, okay, we
Seriously.
got it.
we have someone who says hello from Ireland.
From Ireland?
Yes. If you guys have any questions at all, feel free to say so. Dr. Nemeth is here. Dr. Katranji is here. We are answering questions. What's
Okay.
up? Yeah.
I do want to mention one thing which I'll mention again, and that is Dr. Katranji and I have videos on almost every aspect of periodontal and implant care and treatment, as well as some funny videos on the cot chip challenge. Remember that?
Yes.
But anyway, what do we have? Over 400 now?
Yeah, we're getting close to 400 videos.
So we have close to 400 videos, and if you have any subject that you're interested in, I think they're under drnemeth.com. On YouTube, is that it?
Yeah, you go to YouTube, you search Dr. Nemeth. If you guys are here, you can find the channel easily, but there's all kinds of info for you to check out.
Yeah, and you should subscribe, you really should subscribe to it, and anytime something new comes out, you'll be notified about it.
Yup.
I also want to make this announcement to the wider audience. This is, this is our live stream audience, and there's a wider audience out there also that I need to know about this.
Absolutely. We can mention it again when we're back on the air. Someone is saying that Dustin is asking, Dr. Nemeth.
Can't hear you.
Dustin just asked, Dr. Nemeth, are there any new and upcoming treatments for gum disease that are kind of on the horizon? Or is Lynn?
Yes, you want me to answer that now?
How much time do we have?
You have 2 minutes, we're back on at 33.
Yeah, 2 minutes. Go for it.
Answer it on the air, thanks.
Okay, well, Dustin will answer your question when we're back on live radio. I'm going to kind of give people a little bit of perspective of where we're at, too. Because why not?
Do you find out where they're calling from, where Dustin's calling from?
Dustin, if you want to write in the chat, let us know where you're from, my man. I'll be right back. We've got a whole studio here. This is Startup Nation, Birmingham, Michigan. There's an area where you can have live music. Lots of open workspace. Always love coming here. Their fridge is always stocked with really good stuff. And probably one of my favorite rooms over here is the podcast room. Which you can kind of see. There's a big reflection, but that's where they do all the filming for the podcasts. You can catch a glimpse of Mark back there doing his thing. All right, we're gonna head back in. Dustin's from Iowa.
Welcome back to the special edition of the Dr. Nemeth and Dr. Katranji radio show. I'm your host, Anne-Marie Cronin, and we're here tonight talking with both doctors, both board certified in periodontists in Southfield, Michigan. They're here with us tonight discussing the latest treatments in periodontic care and the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctors and the topics we're discussing tonight, please call us at 800-859-0957. Dr. Nemeth, go ahead, I'm giving you the floor.
Age has made me wise, I think, and I've learned that all difficult questions I refer to Dr. Katranji.
All right. Well, there we go.
So,
Go ahead,
You
Dr.
want-
Katranji,
You
yeah.
can
So-
mention
so-
how
yeah, so the question was,
newer treatments.
what are the newer treatments
or
that
that are on the
are
horizon,
on the
perhaps.
Right.
horizon, things that are available for periodontal disease that maybe other people aren't using? One of the things that we're using is a special chemical that's it's a desiccant, and what it does is it removes all fluids, all anemia, anything that's edema, anything that's in the tissue, it just
Wait, I'm
sucks
gonna
it all
stop you
out.
here, cause they're not all biology majors,
Sure,
are
sure,
they?
sure.
What's a desiccant?
A desiccant,
It
so
dries
something,
it out.
something that dries out
I
tissue.
see.
So if you can imagine periodontal disease, we have quite a bit of fluids building up in the tissue. You have inflammation, infection, bacteria is just creating all sorts of reactions in the soft tissue. And so what this does is it actually draws out all the fluid and brings out everything and kills everything on contact. So it's almost like what's old is new again. It's just a newer version of, you know, a way of removing and disposing of the bad tissue and the bad bacteria in the pockets. And just like the laser works, this works similarly. The laser tends to be a little bit more targeted, whereas this is more generalized.
So is it an injection? I mean, how is this medication applied?
So it's almost like a gel. It's not very thick, but it's thick enough where when we squirt it into the pockets, it goes and instantly interacts with the tissue. So within a period of seconds, you'll start to see, you know, it's almost like a brownish residue that comes out, and we clean all that out with everything else in the pocket.
I've used it, and really what this does, it's a strong chemical that we inject into the pocket. It kills and destroys the organisms that cause gum disease, and it tends to also cause that dries out that tissue and helps those pockets shrink so they're not as deep and they're somewhat easier to clean. So that is something, and very frequently, I know that Katranji does and I do, we use that in combination with the laser. We use them both, and it makes it doubly effective. We do have a question from Susan from Ireland, this is the second time we've had someone calling from Ireland. So Susan says, what are your thoughts on using clove oil for tooth pain until the tooth is treated by a dentist? Well, clove oil is, you know, it's been around for many, many years. I mean, it's sort of I think the ancient Egyptians probably even used clove oil. No, really, it's been around for a very long time, and it can be effective in reducing tooth pain. So clove oil can be used. It may help, but it's not the answer to eliminating the problem, but it may carry you over until you can see a dentist and really have it taken care of. The other thing I wanted to mention while I'm on the air is that we have over 400 videos on almost every aspect of dental implants, periodontal disease, cosmetic gum treatment. And if you go to, I think it's under drnemeth.com, you will find any question that you have will probably be addressed in those videos. So you should subscribe to that channel on YouTube, and then anything new that comes up you will get, and you can take a look at anything that you might be interested in. Lots of people look at that, and we have close to 200,000 subscribers, and you know, we're growing all the time because we want people to know the latest and the greatest that's going on in the world of not just periodontics, but dentistry.
I think that's tremendously important, you know, people just have the access to being able to look at the procedures as you're doing and see what we're talking about here. Because a lot of stuff, I mean, people are still afraid of dentists, they're still afraid of having somebody poke around in their mouth. But before we get onto this topic, I do want to ask Dr. Katranji, you know, we were talking about having a bridge, a bridge cover a tooth that's removed, and implants. And I thought as we were talking about this earlier, so many times when you go to your regular dentist, if you've got a really serious tooth decay, they take the tooth out and then put a bridge, and there are lots of people walking around with bridges.
Yeah.
So can they get rid of that bridge and then put an implant in?
Absolutely. So usually we'd like to see people before they get the bridge, because what does a bridge do? In order for you to get a bridge on, you have to basically destroy the two teeth next to the space.
Now, why is that? Why is that? That's an interesting thing.
You need to support that tooth. That false tooth has to grip onto something.
Right.
And where we get that is from the adjacent teeth, the teeth next to it. So that's where all the stability comes from. But now what you're doing is you're creating more forces on those teeth. and a more difficult area to clean. In some cases, we'll see decay underneath the bridge. And now instead of losing one tooth, you might have 2 teeth that are failing or 3 teeth. So it makes the area a little bit more difficult to treat. So when we're doing these treatments, when we're looking at these patients, when they lose a tooth, it's important to treat them before they get the bridge, because it's much easier for us to save a tooth that hasn't been cut and, you know, used as an abutment for the bridge.
Well, I think this is really important information, because I know a lot of people who are walking around who've had a bridge put in their mouth where they've lost a tooth and then they've had to get a bridge, whether it's the front or the back. And it's just commonplace, I think, within dentistry to accept that that's the only alternative you have. So what you're saying is that's not the only alternative. You can just replace the tooth, get the bad tooth taken out, forget about the bridge, and eliminate bridges altogether.
Right, the gold standard now in dentistry to replace a tooth is a dental implant. We have, you know, over 50, 60 years of evidence that proves that this is a viable long-term solution, and in many of our cases, significantly longer than even bridges.
One other quick question I want to ask you is that a lot of people think that if they have damage or decay in a molar, a back tooth, wisdom teeth they take out, but that it's okay to just have that tooth extracted and nobody sees it anyway. Talk to that. Is that important for us to get an implant where we have a molar that is getting decayed and is going to have to be removed?
Absolutely. I mean, so with your teeth, if you think of the equilibrium in your mouth, you bite on one side, you chew on one side. If you don't use all your teeth on one side and you start using the other side more, what's going to happen is that side's going to break down. And you have 2 molars on each side, on the upper,
Right.
and two on the bottom, 2 on the upper, and they grind against each other. And they're supportive of each other. If you lose one, you're doubling the pressure on the other one. So it's important for you to replace that. And another thing is the tooth maintains the bone. If you lose a tooth, you lose the stimulation that holds on to the bone. An implant works like a tooth in that it stimulates the bone. So you want to make sure that you're holding onto your bone in your jaw, just like you want to hold onto the bone in the rest of your body.
I had a patient recently who lost some teeth, and because the bone, if you don't replace those teeth, that bone tends to atrophy or shrink. The patient said, my cheeks are caving in. You know, I don't know what's going on. I used to have full cheeks, and now I'm looking much older because my cheeks are caving in, and that's because the bone that is withering away, and that bone helps to support the cheek tissue.
Yeah, I mean, it's amazing information, because I think that we've become so acceptable of having a tooth pulled and just getting a bridge or living without a back tooth there. We don't realize the whole mechanics of why it's very important, the movement of the teeth in general. But anyway, we're running out of time in this segment, so we'll come back and talk more on the other side of the break. You are listening to the Dr. Nemeth and Dr. Katranji radio show, and we're talking about how the treatment of gum disease can prevent many catastrophic diseases. If you have a question, you can reach the doctors by calling 800-859-0957. Again, that number is 800-859-0957. We don't want you to miss this opportunity to talk to the doctor directly. You're listening to the Dr. Nemeth and Dr. Katranji radio show on 760 WJR.
Nice job so far, you guys. We are close to 100 people on YouTube Live now, and I think we have a few questions from some of them.
Questions,
That's
but
because
more
we're comical.
importantly than that, I
Oh my
had my
God.
first experience on a kayak today. It was tragic.
What happened?
I just want to mention that because getting out of the kayak, getting in wasn't too bad. Getting out, that was a whole nother story. But we'll go into that another time. At any rate, someone asked, is brushing with baking soda, is it okay to brush with baking soda? It's okay to brush with baking soda. I don't use baking soda because I just think it's better to brush with nothing at all unless you have some serious condition that needs attention. I don't think there's anything wrong with brushing with baking soda. It's okay. Probably less damaging than using an abrasive toothpaste. So yeah, but people have a hard time grasping not using toothpaste. They just have a.
Oh,
It's like.
that's like off the
you-
charts.
you
That's
don't
way
use
off the charts.
toothpaste, they think it's, you will die without toothpaste.
No, well, yeah, but look at the fabulous job that Crest has done of advertising for years. You can't wipe that out in an afternoon. I mean, it's a nice try, but it just isn't gonna happen.
Well, you know, they think it freshens their breath. Well, maybe it does temporarily, but if they
Yeah.
have bad breath, that's gonna come right back. And we treat that. We treat chronic bad breath, and then it doesn't come back.
Mhm.
But, you know, toothpaste, it has its place, but I haven't used toothpaste in years, particularly since I saw that study a number of years ago showing the damage that can occur from the abrasiveness in toothpaste.
Yeah, I know that we get that comment all the time on
Ron's asking
YouTube.
the question, yeah.
I can't generalize that, but I think for the most part, most people are in decent shape and have, you know, decent, yeah, you know, well, yeah, and even if your gum health's not okay, it doesn't mean you need to use toothpaste. It means there are other things that you should be doing to get your teeth clean, like using interproximal cleaners, maybe even dental floss, a water pick. All of those things can be used to get your gums healthy. I think in many, many cases, perhaps most, toothpaste is just automatically used where frequently it's not necessary, but each case is individual, and I don't wanna say, you know, without seeing the patient and seeing what's going on, it's difficult to say, but I just think toothpaste, hey, Crest makes a lot of money, and they know what they're doing.
Spend a lot of money on advertising too, millions and millions of dollars. We got 1 minute left. And this segment, just so that you both know, is 9:50, so when we get, I need 1 minute to close. Thank you very much for watching the clock.
Oh,
Appreciate that.
okay, so we
I'm not
got,
watching the clocks.
No, you need to, because I'm gonna tell you, this is where I give out your personal phone numbers, so that's.
Your personal
that's the
number.
last segment is
Your cell
almost, your cell phone, et cetera, how to get a hold of you, right?
Okay, well, don't give out yours too.
Okay,
And
30
even-
seconds.
You, and I admit, you've had your whole family except
Right.
like one member of the family that I'm looking at.
I know, that's me, I'm next, and I know, I messed up his schedule, so I'm cut off for a week or two. I
Yeah.
thought about that when I went by the other day and they said you had an opening, I thought, oh, I'm scared to go in and ask them.
Of course you're scared. You don't wanna see what, you don't wanna know.
We're starting, okay, fine, last segment. Who
Last
are we coming
segment.
back to?
He's the boss.
either or.
Okay,
Oh, are we back on?
welcome back to the last segment of this special live edition of the Dr. Nemeth Radio Show, joined with Dr. Amar Katranji. I'm your host, Anne-Marie Cronin, and we're here tonight talking to both doctors, both certified, board-certified periodontists in Southfield, Michigan. They're with us discussing the latest treatments in periodontic care and tooth replacement. This is our final segment. So if you have a question for the doctors on the topics we're discussing tonight, please call us at 800-859-0957.
By the way, Anne Marie's family did come in, and her daughter Siobhan was a patient, and she also brought her husband. I don't know, Siobhan, can you chime in on this at all?
You'll have to repeat what she's saying because they can't hear what she's saying in your headphones. The anticipation is building. Repeat what she's saying.
Can't hear you.
When she's done, repeat what she's saying.
What?
Repeat her question when she's done, if you could.
Whose question?
Siobhan's.
What was her question?
I don't know.
Yeah, but, you know, Siobhan was talking about how her husband had all, and the
Right.
thing that I wanna throw in here is, young people think this doesn't apply to them. young people think this type of serious gum disease only happens to old people, and that is a fallacy. It's a big mistake. I think that young people need to know that they can be just as infected
Yeah.
with these parasites at any age. You know, I mean,
So-
go ahead, Dr.
So, yeah, and that
Katranji.
goes down to this question here. I mean, you know, how does genetics play a role? It doesn't matter your age, your genetics are predestined at this point. So if you're genetically susceptible, you know, yes, you're younger, you have a little bit more resistance when you're younger, but if you're susceptible to the disease, it's going to be active. If you take care of it earlier, usually you don't have that damage that you might see later in life in some people who have had no treatment. So we always call periodontal disease the quiet disease.
Right,
People don't realize it's going on. Everybody
Right.
says, I've never had a problem before, I don't have any pain. Pain doesn't necessarily mean disease.
yeah, a
And
lot
that-
of,
Young guy? Yeah.
right,
Yeah, so
That's why
genetics-
most people lose their teeth from periodontal disease, because it's not a quiet disease, it's a silent killer. That's really what I
Yeah,
call it.
absolutely.
Because it's way more serious than people know. And most people who lose their teeth do lose it from periodontal disease or gum disease, because it's silently destroying the bone around the teeth. Usually there's no pain. By the time the patient is aware of it, unless a dentist catches it early or something unusual goes on, by the time they're really aware of it, very often it's so far advanced that unfortunately some or sometimes even all of the teeth have to be removed. So you really want to make sure that you see your dentist regularly and ask them specifically about your gums. I think that's very important.
I think we have a caller. Siobhan, do you have a caller? Go ahead, Siobhan.
We are taking calls and we are taking questions. So if you guys have any questions for Dr. Nemeth or for Dr. Katranji, now's your time. This is the last segment. After this, we will be signing off. So if you have anything to ask, this is your moment. They're listening to a radio call right now. For all of you who are typing furiously and asking questions, this is your respondent over here, Beth.
This is a Dr. Katranji.
Yeah, so I will say that, that's probably not the way, I would have, and it's hard for me to always, comment on these things, but typically I won't do that unless, where in the jaw was this problem? So the lower center tooth can be a very difficult area. And in those cases, they can be complicated with space. If you don't have enough space, for instance, sometimes it's easier to take a second tooth out, and then do that. My preference would have been to place the implant on one side or the other and do something called a cantilever, but I know a lot of doctors who put it in the center and then have, two teeth, coming out from that in the middle. But everybody does things differently. In the front of the jaw, the front bottom, that can be a very difficult space if you don't have enough. Yes.
Yeah, that's a tough area, but we gotta cut you off now, because we have some other things we need to talk about. We love you very much, but we
Okay,
have to go on to
thank
other
you
things.
very much, Lisa, for calling. Go ahead.
So,
We got a couple of other calls.
We have one patient who wants to know about burning mouth syndrome. Well, burning mouth syndrome is really pretty common, and it tends to happen as very frequently we see it in postmenopausal women with their hormonal changes, It's difficult to treat, but it tends to come and go. And it goes along with dry mouth frequently. And there are things that one can use to keep your mouth moist. What are some of, what's the name of some of the things that are used?
Stella Life, we use something like
Stella
Stella
Life,
Life.
there's something called, starts with a B.
Biotine.
Biotine, yeah, so there's not really any specific treatment for it. It will tend to come and go, and I think eventually it probably will get better. It can have to do with medications, because certain medications will dry your mouth out. When your mouth is drier, there's more of a tendency to have burning mouth syndrome.
Wait a minute, do you have another question, Dr. Nemeth?
Yeah, one patient says, how do you know if you need Lenap or not? Well, it depends. First of all, it's going to depend who you go to. There are some periodontists who use Lenap a lot, and other periodontists that don't. I think you really need to be evaluated by your dentist or by a periodontist. If you have periodontal disease, then I think Lenap is that's in order, but it's hard to know if you need Lenap unless we know what's going on with your mouth, quite frankly.
Mm-hmm.
So they have to, the bottom line is they really need to go and see a periodontist and have a serious evaluation.
Or a general dentist.
Like
A
what
good
you're
general dentist can, usually tell if there's bone loss. Sure.
I'm going for the periodontist. Go to the specialist whenever you have an opportunity to go to the specialist. Well, this has been a great show, but unfortunately we're out of time, and that wraps it up for the Dr. Joseph Nemeth and Dr. Mark Katranji radio show on News Talk 760 WJR, sponsored by the North American Society of Periodontists. I'm your host, Anne-Marie Cronin, and again I want to thank Drs. Katranji and Nemeth for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed periodontic disease. To take a closer look at the practice, please go to YouTube or search drnemeth.com. You'll find a wealth of informative videos on the many treatment modalities now available to treat gum disease. Thank you also to my co-host, Siobhan Cronin. To learn more about Dr. Nemeth and Dr. Katranji's periodontal practice, you can reach them directly at 248-357-3100. That's 248-357-3100. Or by visiting them on the web at drnemeth.com. We hope you've enjoyed this special show and that you become more informed about periodontal disease and its impact on the major diseases of our time. Good evening, and thank you for listening.
Thank you.
Great job, you guys.
You guys gave
We've
me
got-
a minute to get out.
That was the first time.
Few seconds.
And Dr. Nemeth, this is the most people that we have ever had tune into one of our live streams. So I just want to say thank you guys for everyone for watching and tuning in, both from Dr. Nemeth and Dr. Katranji. We appreciate having you here. We're going to do more of these live streams so that you guys can
If
answer.
they're still on, we can show them some pictures of some of the bone growth and some of those other pictures.
I have them on my laptop. Yeah, I mean, might as well.
Do they know anything about hydroxyapatite toothpaste?
Johnny, you off?
Dr. Nemeth?
Yeah, Siobhan says she can send you, Skylar,
Yes.
she can send you the video of Brock having his
Oh,
test done.
she got, he did a screening.
Because he's coming in, he's gonna get the treatment, and he came up from Columbus.
Wow. Oh, nice. That's great. Yeah, if she can email it to me,
Send it to you.
perfect. So like I can pull this up here. So you guys might have seen this in one of our previous videos.
Skylar,
This
how do you
woman
want me to
actually,
send it to you? Thank you, Dr. Nemeth says thank you.
to email
Siobhan.
please. Dr. Nemeth, you remember this case? What do you have to say about
Dr.
this?
Katranji, hello. Put on your headset.
That,
Siobhan's saying goodbye.
That-
Thank you for
that-
being
Oh, thank you, Siobhan.
on. There you go.
Great, thank you.
yeah, this is an example of pinhole. This is before with all the recession.
Okay, Siobhan,
And
did you
after
send it to me?
treatment, this is what it looked like.
Yeah. And why were the teeth so yellow on this one?
I think that the patient had
take
fillings that
off
were
sensors, yes.
absorbing stain,
Mhm.
and also was a smoker and a tea
looks
drinker,
good.
which also stains the
Okay,
teeth.
thanks. Look great,
So I
thanks.
think that those were the primary causes of the staining.
Mm-hmm. Here's another one. This was the one that you just did last week,
Yeah, this
right?
was just a patient who came in today.
Get implants.
This was what it looked like before. You can see the roots.
Depends on the
And this is what it looked like afterward, where there's lots of gum tissue and the roots are covered.
Mm-hmm.
Okay for.
We want to have some pictures of implants because implants are great. And that, of course, is Dr. Katranji's purview, and hopefully we'll have those next time.
Yes, absolutely.
And this was a crown lengthening. Patient had too much gum tissue, gummy smile. We corrected it, and it's almost like two different people.
Yeah, it really, really is. How happy was she when that was done?
People like that, they usually cry with happiness afterward.
Mm-hmm. Let's see what else
And
we
if you
got.
have- Yeah, that's another pinhole technique. What about some with bone growth?
Oh yeah. Let's skip ahead to the bone growth cases. Here we go.
Yeah, and you can see this is an area where the bone was lost. After the pinhole treatment, the Lenap treatment, the bone filled in, and the patient now has good solid bone, and that tooth can be saved.
Mm-hmm.
There's some more, but we'll bring some more photos for the next session, and I think some for implants, because I think it's important for you to see those too. And
Yeah, it really is.
as I say, if you're probably a subscriber, but if you're not, subscribe to our YouTube channel, and we'd love to have more questions from you. So just remember what I always tell everybody, and that is, if your mouth's not healthy, your body can't be as healthy as possible. Healthier mouth, healthier body. Healthy mouth, healthier body. And everyone have a wonderful, wonderful evening and a great day.